Hi everyone, I'm Dr.Z. I am a clinical psychologist specializing in adult transgender care. Welcome to my channel. If you are new here, make sure you do subscribe because that way not only will you be getting uploads of when the new videos are up, but you will be helping supporting me and helping everybody else to find this free and very helpful content. If you're regular viewers that also have not yet subscribed, I would very much appreciate your subscription as well. Again, this is the best way all of you can support what I do, how I create, and the content that I put out. If you don't yet follow me on Instagram, link is below. Follow me on Instagram. And finally, last announcement. I am starting a membership group for trans women only called Circle of Trans Womanhood. Link is below. The doors open on June 14th. I will make also a separate video about it if you're interested. It's a great way to connect to your trans sisters, no matter where you are in your gender transition. On top of that, it is also going to have a lot, over close to 20 individual video workshops recorded by me on finding and solidifying your sense of womanhood, as well as monthly Zoom group meetings with me. So it's a great way to connect. Link below, check it out. So having said that, welcome to our now Fridays Q&As. This is a place where you send me your individual questions. I ask you to keep them relatively short and to the point, and I randomly select 5 from the folders that contains all of the questions, and I go through them and I give you my best feedback, support, guidance, and expertise based on the questions that you ask. As always, I keep all of the informations blacked out, so there's no identifiable factors. If you want to participate in Q&A, all you gotta do is email me your question to email is in drop description box, basically info@drzphd.com, and I'd be happy to include it in Q&A. Having said that, let's get rolling. I selected 5 questions. I glanced through them, look very interesting as always. All of you are sending such fantastic and great questions. I believe the audio should be very good at this point. I think I finally cracked the code, so it should be nice, crisp, and clear to hear Dr. Z. As you can see, I'm in a very cheery mood. Today I'm very re-energized because tomorrow's my day off and looking forward to getting cut and color done to my hair. Anyways, enough about me. Let's get rolling with questions. Question number 1. I am a 51-year-old male that, thanks to you and your content, have been baby stepping into expressing my feminine, which has been with me since I was very young. I do dress feminine/androgynous in everyday life, but one of my main sources of dysphoric feelings comes from my male pattern baldness. I'm saving money to have hair replacement surgery, but want to know if that is a good idea if I do consider hormones in the future. I have heard that hair in certain areas can either become thicker or thinner. Is this true? And will this later head hair growth due to hormones look right if I had replacement surgery beforehand? Thank you for your content. You have helped me immensely. First of all, you're so welcome. So this is a great question, right? And I do have quite a bit of insight on this question because early male hair loss, early signs of male baldness are very common. And it is incredibly devastating for so many individuals to experience and to go through this. And it can be very, very challenging. It can be challenging because as you're stepping into your femininity and you want to embody your feminine, struggling with hair loss it can be very painful, triggering, can be quite traumatic. Wearing hair wig, even if it's a really good hair wig, can also be uncomfortable. Wigs are uncomfortable. I know this first and foremost because when I had cancer at 16 years old, I lost all of my hair. As you know, you lose your hair due to chemotherapy treatment. I got 16 chemotherapy treatments, and I lost all of my hair. So I wore a wig, and I know firsthand how wigs can be uncomfortable if you live in a climate where it is warm, humid, or hot. Wigs can just be not so pleasant to wear. They can itch. It's not the optional or ultimate. We all know that. And for those of you who are watching this who do wear wigs, also understand and know that as well. On top of that, for a lot of trans women who do struggle with hair loss, the process of taking off a wig in the evening as your bedtime routine before you get ready for bed, and seeing lack of hair increases and spikes up dysphoria, it also can make one feel incredibly depressed, because it syncs you up with the feeling of pretending, cosplaying, costume, a feeling that you're somehow not really real. I want to remind all of the viewers, something that we should not even be reminded of is that women lose their hair too. Women have early signs of hair loss too, due to menopause and just stress, a lot of other things. Women do lose their hair too. So you're not only women in a group of women who struggle with not having hair. Having said that, what is my advice? If you are thinking about studying hormones, how is that going to impact? A few things. If you're considering hair replacement surgery, which I have seen do wonders to individuals, especially do wonders to individuals where either they want to have a little bit more of a hairline, so lower hairline, or wonders to individuals where they have more of the hair around their head, but they have a bald spot on top of their head. I've seen amazing results with hair replacement surgery. But I have seen this, and this is really important to keep in mind. For hair replacement surgery to be successful, you need to have a site where a surgeon can harvest the hair from. Usually it is going to be for a lot of people in the back of their head, on the side of their head, if they have a lot of hair. It is also hairs that tends to grow on the chin and toward the lower side of the neck. All of those hair follicles can't and are harvested. I'm bringing this up because I have had a client that struggled with early signs of male baldness, and she started hormones. And as we always do when we start hormones, electrolysis usually the first thing a lot of individuals focus on too, because facial hair is very triggering. It also can lead to misgendering. So she went through electrolysis, got rid of all of her, and she had a full-blown beard, got rid of all of her facial hair, got rid of all of her neck hair. And then when she finally was getting ready to do hair transplant, there just wasn't that many hair follicles to work with. And it was devastating for her because her surgeon told her that if only you did hair transplant first, electrolysis second. So for all of those of you watching who are thinking about hair replacement surgery, and you have full facial, you have quite a bit of facial hair, do keep that in mind. In the very least, see if you can somehow manage to keep a lower part of facial hair while working electrolysis on the top part. So this is one of the tips that I have to consider. Now, hormones, you mentioned here that you have heard that hormones can either thicken or thin out the hair. In my experience with my clients, hormones usually thin out hair follicles. They don't stop hair follicles from growth, but it helps thin it out when you go on estrogen. And so when you do go then through the process of hair removal, electrolysis, laser, it's that much more helpful, right? Testosterone tends to speed up hair follicles growth. Estrogen tends to just thin it out, at least what I have seen. Will this later affect head hair growth due to hormones? Look, right, so I have not seen this had any effect at all. So I've seen people who had hair replacement surgery, and then due to the hormones and everything else, I have not seen any effect. If anybody else listening and have had a different experience, please do share in comments below. I think that, in fact, doing hair replacement surgery before again you completely remove all of your facial, if only you need the hair to harvest it, is a really prudent idea. But I have not seen the thickness or thinness affecting how your hair replacement surgery is going to overall come through. So keep that in mind. I would also recommend for you to talk about all of this with your hair replacement surgeons, see what their experience has been, see what insights they have, and what kind of information and guidance that they offer you, just in general in terms of hair follicles and what to know about hair growth. But really, really good question. Again, if anybody have any additional feedback, comment below, drop it below in the comment section. Apologies. I sometimes forget to turn off my email. Okay, great question. Next question for today. Question number 2. Hello, I am a bi-gender, transmasculine person. I have gender dysphoria mostly around my curves and some around my voice. I have been thinking about starting testosterone for around 3 years now and been fully socially transitioned for about 2 years. I'm very scared of losing my femininity completely, which makes sense if you're bigendered, which is identifying as duality of gender, whatever those duality for you might be, especially in my face, and therefore being forced into a role and body I don't want. However, body dysphoria affects my daily life. What is your advice? Clarification: fully socially transitioned as non-binary/male. Okay, so fully socially transitioned identifies as non-binary, more masculine, toward more masculine, and quite a bit of body dysphoria around particularly body curves and physical appearance of the body. Wanting to consider testosterone, starting testosterone to masculinize those body features, and very concerned about losing the femininity, especially in face, because as we know, testosterone is a very powerful hormone. You may experience hair growth pretty much relatively fast. For some people, it might take years. I've seen trans guys, 3 years on testosterone before hair follicles kick in. So it just shows you how drastically it's different for everybody, and you won't know what you're going to experience or what it's going to be like for you until you're actually going to try it. In this situation, my advice is this. This is one of those situations where you are at a crossroads where you have to ask yourself, because this is a situation where something is going to have to give. You won't be able to have it all, right? This is a situation where physical dysphoria is starting to really get to you, experiencing it daily. And at the same time, if you do go on testosterone, you may masculinize your face, and you don't want to give up the feminine features of your face as somebody who identifies as non-binary, bi-gendered individual. This is where a careful discussion with yourself about what's going to cause you, in other words, what's going to give you the bigger pain point. Unfortunately, this is how you're going to have to look at it. Is the biggest pain point in this case going to be living with dysphoria, physical dysphoria, or will testosterone take care of it and you'll feel better, but now that your facial features masculinized because of testosterone, are you now going to have another form of a daily dysphoria that is going to then bother you? So are you now trading one dysphoria, in this case in regards to your body and the curves, for another dysphoria, in this case facial hair, deepening of the voice, also the jawline the bone structure tends to thicken on testosterone, so the jawline can a little bit appear thicker. it's a huge gamble, right? I don't like when my clients are even considering to gamble with trading one dysphoria for another. That is just not, it's not conducive way to go. I would recommend for you an alternative. An alternative that I would recommend for you is, because you're right now experiencing mostly dysphoria around physical aspects, and you mentioned that mostly around your curves and around your voice. One, you can masculinize your voice with voice therapy for sure. I know this for a fact, without going on testosterone. Just like women with trans experience can feminize their voice with voice therapy alone. The way we sound is not innate. It can be changed. Don't forget, this is a tool. This can be modified. So that would be my first suggestion. Can you work on that? Another suggestion is, since you have also dysphoria around curves, curves derive from, at least the way that I see it, two things play role in perception of curves or curvature. Bone structure, right? Primarily hips, the ratio of the pelvis, the hips, and how much of fat tissue is also layering that bone structure. Generally speaking, individuals who are assigned female at birth, will know this, do tend to have curvier skeleton. Do also tend to collect, not all women, but for a lot of women, fat tends to be distributed around hips, stomach. This is because evolutionary to protect those body organs. It's also evolutionary to create an internal ecosystem for a woman, to prepare her to be able to bear and go through pregnancy. So there's a lot of other evolutionary things that play a role in why. Now, you can change your skeleton, right? You can change your bone structure. You can, however, work on the curves through fitness training, weightlifting training. I have seen, and I had clients, trans masc clients, who done it, who focus specifically. Yes, you probably will have to do a little bit more research and have an understanding of fitness and weightlifting and what specific exercises are going to actually minimize those aspects and masculinize them in a way where it's going to give you a different body appearance. But I've seen people do it. So this is my advice. Instead of considering testosterone, which again, you're gambling with trading one dysphoria for another, see if you can shift your relationship and perception to your body through fitness and see what's going to happen. And then also see if you manage to do voice training to masculinize your voice. That would be my advice to you before considering testosterone. Because again, I'm only giving you this advice because testosterone can affect your, while, yeah, it can also drop your voice, which is exactly what you want, but it can also give you other things you may not want. So something to think about, but this is a really, really good question. And anytime non-binary identity involved, there's individuals who are non-binary identified. It's always a tough one. There's always this little bit of consideration of alternatives, or just to be a little bit more creative in approaches. But really, really good question. Question number 3. Myself and my close friend group are all transgender, as well as having autism and a dissociative disorder. It also seems, I paused because there's dissociative disorder and there's also dissociative identity disorder, which are, one is where it's quite different, but all under somewhat similar umbrella. So I'm just making mental notes for myself. It also seems every time I meet someone new that's transgender, they're also neurodivergent in some way and have issues with severe dissociation. Wondering your thoughts as a clinical psychologist on this. So, good question. I get ask this question quite a bit. Not so much about individuals in regards to dissociation or dissociative identity disorders, which is again completely different ballgame, but to individuals who are neurodivergent. And in terms of, I get this is such a common question, especially from general public. Don't you think that there's correlation between neurodivergent individuals and gender dysphoria? And isn't it something telling about gender dysphoria? I'm going to speak from my observational experience from working over 20 years with a lot of individuals, including individuals who are neurodivergent, who are also, and also who do have dissociative features. Bear in mind, I am not currently in touch with any research that is done on particular segments of populations and correlations in regards to gender dysphoria. I will tell you why. One of the reasons why I'm not in touch with it, and this could totally be my blind spot, is because the more I dive in the world of gender dysphoria, the more I'm baffled how far and deep it reaches. And I have first-hand seen gender dysphoria and witnessed gender dysphoria affecting so many individuals. I've seen people with comorbid mental illnesses have gender dysphoria. I've seen people with, who are neurodivergent have gender dysphoria. I've seen people who have personality disorders who have gender dysphoria. I've seen people who had trauma and alongside trauma have gender dysphoria. I've seen it all. So what I have learned, and again, this could be my blind spot, is that gender dysphoria exists along all sorts of individualistic expressions and dynamics. And it does not discriminate, and it does not pick and choose particular group to settle on. We as human beings, and myself included, if you've been a fan of this channel, we love to cluster, categorize. I love to put things in a group and patterns because that's just how my mind works. We as human beings love to do that shit. We just love to create correlations. Oh, look, there's correlation, neurodivergence and gender dysphoria. That's got to be something telling. And in reality, in my experience, gender dysphoria is distributed pretty evenly across the board. It strikes people of different demographics, different struggles, challenges at different ages of life. Like I said, it does not discriminate. So my thoughts on it is that, again, we, special social media, tends to really loves to sensationalize when there's particular cluster of groups, right? In this case, this was actually several years ago. It's not even that predominant of a conversation today, but I would say probably 7 years ago, maybe, there was this whole big conversation about neurodivergence and autism and individuals who are on a spectrum and gender dysphoria and all of that correlation, and what all of this means, and why is it so common, and why is it that every other individual who's neurodivergent also has gender dysphoria. That is not true. Not every neurodivergent person has gender dysphoria. I mean, come on. My stepdaughter is neurodivergent, zero zilch of gender dysphoria. So I think that we tend to, when we start paying attention to some things that we perceive as a phenomenon, and then that is also being clustered and being put into particular groups and patterns, it's almost like our brain can't help but suddenly see patterns everywhere and assign patterns to things that may not necessarily be pattern clusters, but we tend to think they are. So for you, for example, you just happen maybe to be in a close group of people who have transgender experience, are also neurodivergent, and also have dissociative disorder. Like people with like commonalities gravitate toward like commonalities, right? So I think that's just very common. That's what I make of that. Now, in terms of dissociative, I'm not going to touch base on dissociative identity disorder because that is quite rare. And again, yes, people can also, alongside dissociative identity disorder, which formerly known as, what is multiple personality disorder, and then there was another name for it, I believe. And then there's also dissociation as defense. In transgender community, among individuals who are living with transgender experience and histories, dissociation as a defense, as a psychological defense, is incredibly common. And it can run from very mild dissociation, where a person is not even aware they're dissociating, to a very strong level of dissociation where they literally feel like they're having an out-of-body experience. Dissociation initially is a psychological defense that tends to stem from severe traumas. It's our mental way of protecting ourselves from experiencing a trauma when it's happening. So when we dissociate, we split off from experience. So it's almost like we're present, but we're not necessarily fully feeling and experiencing the trauma. And it's a way of protecting ourselves from it. It is not surprising that it is pretty prevalent as a defense among individuals with transgender histories, because the experience of living a life with gender dysphoria and navigating the world that does not see you, navigating the world that tries to exclude you, is going to be traumatic, is going to be difficult. So that's as a defense. Again, very clearly, not dissociative identity disorder where you are now splitting, where there's a split on a mental plane, and individuals has clusters, fragments of their selves that has blasted off and fragmented into distinct personalities, into distinct aspects of the self. But when a person is still cohesive cluster, cohesive self, but utilizes dissociation as a defense, that's common. It's common for anybody who is going to struggle with some form of trauma. And again, it just so happens that being an individual living with transgender history is traumatic in this world. So I want to be careful that it's not that dissociation is like linked to gender dysphoria. It's just that living a life as a trans person is hard. It's really, really, really hard for a lot of people. And we need to acknowledge that. But great question. Like I said, I don't have any clinical thoughts on this because I've seen gender dysphoria affect everybody across the board. It does not discriminate. It is. There was a time when I did my dissertation for my PhD, for my doctorate. I did dissertation on individuals with gender dysphoria, and when I did literature review, I did my dissertation in 2013. That's over what, 24 years ago? No, 22 years ago. I can't do math today. You would be shocked how little literature review there was. All of the literature review, and this is only 2 decades ago, majority of literature review was aimed, majority of studies, psychological, clinical, peer-reviewed studies were focused on trying to study and evaluate individuals struggling with gender dysphoria to find out if they are struggling with personality disorders, to find out if they also have, alongside gender dysphoria, a mental illness. It was, the research is so pathologizing, it's not even funny. It's almost like, and I don't think that the researchers doing it were all aiming to pathologize, but I think the researchers back then were just associating gender dysphoria with a mental illness, period. And seldom anybody was doing research on how it affects the quality of life, what helps individuals cope, how can we better the quality of life. It was just all aimed at, does this group of individuals with gender dysphoria have additionally mental illness, so that, then it's kind of explains why they also have gender dysphoria, just to give you an idea. So as a clinical psychologist, again, I just have seen that gender dysphoria does not form any clusters of particular groups. It affects everybody. Rich, poor, beautiful, whatever. It affects everybody across the board. So that's what I make of it. I make it, there's people who are neurodivergent and have gender dysphoria, and there's people who have dissociative identity disorders and have gender dysphoria, and then there's everybody else who have other stuff and have gender dysphoria. That would be my answer. Hopefully that clarifies. Question number 4. I'm 56 years old, male, assigned at birth, and have late onset light medium gender dysphoria. As a male, I've always liked women, both romantically and sexually, and hasn't changed since my mid-20s. Oh, and hasn't changed, sorry, I forgot to pause there. Since my mid-20s, I fantasized of being with other men, but only in sexual setting, and me being a woman. I don't see myself as bisexual or gay, since these identities don't resonate with how I feel or identify as. I'm wondering if other people in the trans community have had a similar experience. So, 56-year-old male assigned at birth and have late onset light medium gender dysphoria. Your sexual history is always being attracted to women, both romantically and sexually, and that still hasn't changed. But you have had fantasized being sexually with other men when you are envisioning yourself as a woman. However, you don't see yourself as bisexual or gay, so you wonder what the heck is going on. This is so common, my friend. So common. I mean, I wonder how many of you are raising your hand right now. I will tell. So there's lots of, not a lot, but there's a few explanations for this. And I know it can be quite confusing when I work with people and when we go through the process of discussing and trying to figure out if they truly have gender dysphoria, what else going on. One of the questions I will ask individuals is not only a lot of questions about their sexuality and sexual preferences, but I will also ask individuals who are male assigned at birth whether they are sexually attracted to men. Oftentimes people will say no, and then I will say, but when you envision yourself as a woman. I also have a lot of clients who are going through transition and who are so confused because they're attracted to women, they're not attracted to men, but sometimes they can fantasize being with men, or they even have dreams of having sex with men, and they're confused because they don't really see themselves as sexually interested in men. So it can be very confusing. But this is very, very common. And one of the reasons why this is common is because the part of you ego that is connected to your assigned gender, to the male gender, is also connected to your sexual history under the gender, and that is being strictly attracted to women. So when you are consciously connected to that ego part of yourself, you're not going to be able to imagine yourself being sexually interested in men because you are occupying or orbiting a gender identity of a man. However, when you allow yourself to drop into your actual authentic gender, which sounds like for you with a late onset, I'm assuming you're not very clear in here, but let's make an assumption here that you're realizing that you're actually a woman or trans femme. When you allow yourself to drop and to connect to that part of you, then if you were to imagine yourself as a woman, then that possibility starts to be possible. And the reason why it starts to be possible is on one hand, it could be, which is commonly happens, is that as occupying a woman gender identity, as occupying that, orbiting that gender vortex, you as a woman do have sexual inclinations toward men, which in that case, by the way, makes you a straight woman. Unless you also equally as a woman have inclinations toward women, then it does makes you bisexual. So that's one of the things. I talked about it in one of the videos quite a bit, because our sexuality is also connected to how we see ourselves in regards to our gender. Sexuality and gender are two different things, right? Because gender is how you identify in relation to your gender. Sexuality is who you're sexually drawn to. But your frequency, your vibration of who you're going to be drawn to is still going to be coming from a thread of the gender identity you're occupying. You see what I'm saying? So when you're not in touch with your gender identity, and when you become in touch with it, it starts to awaken sexual desires that you never realized you had. All of this is normal, natural. Another reason why sometimes individuals who are not attracted to men at all will start fantasizing sexually being with men while they're going through transition or as women is because there is a deeper level, a need and a desire to be fully validated. We still carry this innate idea and concept that there's a lot of validation through sexuality, right? So if a man is attracted to a woman, she's really a woman. If a man sleeps with a woman, she's really a woman. We're still carrying all of these narratives and scripts. And so I also have seen individuals where they desire that because they just desire that validation. But deep down, they're really not interested sexually being with men. I say just explore and be open to it. Don't be quick to categorize it as like, I don't see myself as bisexual or gay. Just be open to it. Things come up in us for a reason, right? If we are having certain fantasies, even sexual fantasies, during transition or early stages of transition that may be different than the sexual relationship we had in the past, those things are trying to tell us something. Those things are emerging from within of ourselves because they have been there. And it's important to pay attention to them and what they tell you. I have a lot of clients who are terrified of the idea that they might be sexually attracted to men because they just kind of can't imagine it. But the reality is that, you, as a woman, as now sitting at a throne of your authenticity and your authentic gender, if that's your sexuality, that's your sexuality. That's what excites you, that's what drives you, there's nothing wrong with that. There is nothing wrong with that. Again, as I mentioned in another video, I do really believe that human beings pretty much way more bisexual and bigender than they ever realized. This whole idea of heterosexuality and all that stuff, and then only binary gender, it's such a human invention. I'm not even gonna go on. But great question, very good fun. So I have last question for today, question number 5. As someone who has navigated both the fashion world and advocacy as a gender fluid person, visibly expressing both male and female presentations, how do you navigate the societal pressure to conform to marketable or palatable versions of gender, especially when that often conflicts with the deeper need to live authentically? What does that tension reveal about society's willingness or reluctance to accept non-binary identities beyond aesthetics or trend? And that's a really good question. It's $1 million question, really, in terms of what does it reveal about society's willingness or reluctance. If I were to answer that question, I would say it reveals that we're still very far behind. I would also say that it reveals human tendency to cling to control of knowing, to control of what they know, to control the narrative that they have created, because they're so afraid and so terrified of broadening their perspective. I also would say that another thing that I think it reveals is, I think it reveals a funk. I want to use the word funk as a stench, smell, a funk of fear. This is just my opinion. I think that, in my opinion, people need to start learning how to do inner work. What I mean by that is that people need to start learning how to work on themselves, work on their own inner garbage, all of us. And by learning to detox and by learning to clean up, because we are kind of like, have so much garbage within ourselves, we become more self-aware. The more self-aware a person is, the more they are grounded in their individuality because they know themselves. The more a person knows themselves, the more they're calm, the more they're composed. You've known those people, you came across from them. You've seen them even as world leaders. They're often calm. My God, Michelle Obama comes to mind. They're often calm. They are mindful how they speak of others. They're mindful how they navigate conversations. They're giving, they're loving, they're compassionate. If they run into things that they don't understand about other people or other people's choices, they see that as something they don't understand, rather something that they need to judge, or rather something that they need to dictate somebody how to be. We've seen those people. We continue to see those people. For me personally, I don't know about you, for me, the goal is to become that person. I try to work very hard on myself because I realize that the more aware I am, the more I operate from a place of calmness and I respond versus react. When you are rooted in a seat of your individuality and you know yourself and you're comfortable with yourself to a certain degree, you're confident in who you are. When you're confident in who you are, people who are confident and also self-aware, I promise you, do not discriminate against other people and how they express themselves. In fact, they hold space and open up room for others to find themselves and their individuality because they first and foremost understand how important it is, not only for each individual, but for overall collective humanity. And those people exist all around us. And those people are the ones who have done and continue to do deep inner work. So what you are confronted with, this societal pressure, the societal pressure to conform comes from individuals and groups individuals and groups who are not self-aware, have not done inner growth, and they are clinging and they are holding on to control of the narratives they've been given because they're so terrified that without this narrative, they're lost. They're lost. And if they're lost, then who are they, right? I mean, it's kind of the whole premise of religion. If you think about it, organized religion, right? We've got to hold on to this, like, Bible is the only word of God and there's no other religion and there's no other way to be. Because if I allow possibilities that there's other ways, then that means I have to question whether this is even valid. Just to give you an idea. So when people ask me who are gender fluid, who found a beautiful rhythm, a beautiful dance with their selves and their identities, I really encourage you to hold on to that beautiful dance. I guarantee you this beautiful dance is so empowering and encouraging to the rest of us who are also struggling to hold on to our individuality, who are also struggling to hold on to our sense of being. We need you, and we need all of us who are doing our inner work. It's hard to hold on to your dance when there's people around the dance floor who are not willing to learn how to dance, who all they do is mock and criticize and speed hatred. It is very easy to do all of that. As I always say, criticism is cheap. It doesn't cost anything. But to learn how to do your life dance, once you learn it and you have it, nobody can take it away from you. So, my advice, forget, you question how do you navigate the societal pressure? You continue to dance. You continue to dance. You continue to be you. And as you dance, you just realize that you are surrounded by other people who don't know how to dance, who will be stepping on your toes. And there's nothing you can do about it, and just make peace with it. But you just keep on dancing. The minute you stop dancing and the minute you start to conform, not only you lose yourself, but you're editing so much animosity to the world, because you're going to resent yourself, you're going to resent the world, you're going to be so angry at everybody and everything, because that's just what happens when we're not ourselves, when we lose ourselves. We see those people who do the jobs they hate but are afraid to quit, people who are in marriages they cannot stand but they're afraid to leave, people who go to church and pray to God they don't believe in because they're afraid to leave. A lot of those people are hateful, they're negative, because you can't be happy in that position. You just can't. So this is my advice to you. Hopefully that answers. Sorry if I went on a tangent. I'm a little bit chatty today. You just do your beautiful dance, please. Don't ever stop. Don't let them stop you. I'm so sick of saying, it's not that I'm so sick of sameness, I'm just so sick and tired of people not doing inner work. I see this every day. Either in the comment section on my YouTube videos, just all around me. I just see it. I see it. And it's like, just do the work. Sit down with yourself. Pay attention to what you say out loud. Pay attention to what you comment. Is this necessary? How is this helping? So hopefully this is going to be a little bit of a guidance to all of us to do our inner work. Hopefully all of you are doing your inner work. I know that as you step into yourself, you have to do that, and you are facing and doing it. Great questions. If you have a question for me, all you gotta do is email it to me and I would put it in a Q&A folder. Hopefully this was all insightful for all of you. Comment below, share what your thoughts are. Give this video a thumbs up, also helps algorithm. Connect with me on Instagram. Join Circle of Trans Womanhood, link is below, and I will see you all next time. Hopefully with my hair cut and trimmed. Goodbye.